Now to a promising new study out today that suggests a male contraceptive could be available soon. It comes in the Journal of Clinical Endocrinology and Metabolism. It found that injectable testosterone in men can be highly effective in preventing pregnancy with relatively few side effects, and it's reversible. Well, Dr. Nancy Seidemann is NBC's chief medical editor. Hey, Nancy.
Hi,
this
Annie.
begs a lot of questions. Good morning.
Yeah, it's a pretty good study. It's interesting. Over 1,000 Chinese men between the ages of 25 and 40 who already had fathered a child. The goal was to see, is there a contraception that works as well as everything else on the market, and is it safe? And in most of these men, it dropped a once-a-month testosterone shot, dropped the sperm rate such that men temporarily were infertile.
We're going to put up a graphic of all the other sort of ways that contraception sort of has high effectiveness rates. How does this one measure up?
This one measures up pretty well. Obviously, when we talk about ways of preventing pregnancy, we talk about birth control pills, condoms, IUDs, with birth control pills really being at the top of the heap. This is right up there. And one thing that young people always want to know is, if you're talking about birth control pills and condoms, you're talking about reversible forms of birth control. You're not talking about having a vasectomy or having tubes tied. And the fact that you can have an injection, that it works while you take it, but that when you stop it, you get sperm counts back, that's very interesting in this study.
I think every woman listening might be asking, I wonder how many men would actually do this.
Well, I asked the same question, and I think the question for women is, would you trust a man to show up once a month to get his shot? Would a man do it? Men sometimes don't like things like sperm counts tinkered with. Would they be compliant? And I think, obviously, those are the absolutely important, intimate questions that any couple has to talk about if they're engaging in sex and they want to prevent a pregnancy. Whether a woman's taking a pill or whether a man's getting a shot, that question has to be openly talked about.
How soon before this is on the market, Nancy?
Oh, I think within the next 5 years you're going to see it, and it looks pretty safe. Yes.
All right, Dr. Nancy Seidemann, always a pleasure, dear.
Thanks,
Thank you so much. And